How to prepare for your visit to the dentist. Hello, Dr. Ho and Dr. Navarro.
Hi Justin, hi Novi.
So happy to see your beautiful smile today.
Thank you. That's why we're calling today. As Special Olympics athletes, we want to make sure we're doing everything we can to keep our bodies healthy, including our smiles. Justin and I are going to the dentist. Do you have any tips?
Absolutely. First, remember write down all of your questions for dentists before your visit.
And prepare your paperwork in advance. This includes your health history and any check-in forms. Bring a list of your current medications, including the dose, frequency, and why you take them.
I printed a worksheet from the Smile Generation website to take to my appointment.
That's great, Justin. The Smile Generation website is a very helpful resource. Your visit should be a pleasant experience.
Thanks, Dr. Ho. Anything else we should learn about going to the dentist?
Know that dental visits will help prevent or detect problems. The dental team can teach you how to better take care of your teeth and your gums. Just brushing and flossing is not good enough to avoid dental cavities and gum disease.
That's right. We're here to help you learn how eating healthy, hydrating, and getting enough sleep can lead to a lasting, healthy smile.
We love volunteering as a dentist for Special Olympics healthy athletes, where we teach athletes how to improve their oral health and where we train other dentists to address various risks of cavities and gum disease. Please know that you are always welcome at Special Olympics Healthy Athletes Special Smile Screening or in our practice.
And thank you, Dr. Ho and Dr. Navarro. Do you have any other dental health tips for Special Olympics athletes like myself?
I have lots of great oral care tips to share with you. Where would you like to start?
How about with something we do every day?
How to brush your teeth.
Most toothbrushes have suggested age ranges, but if you're not sure you are using the correct toothbrush, bring it to your next dental appointments to check. The brushes should be soft. Do not use foam or hard toothbrushes unless your dentist recommends it. It can damage your teeth and gums. Your toothbrush should be changed every 4 months or if the bristles are no longer straight.
What about electric toothbrushes?
Generally, electric toothbrushes can do more thorough job. No matter what types of toothbrush you pick, place a pea-sized amount of fluoride toothpaste on it. Brush your top teeth back and forth gently using short strokes or light scrubbing motion. Brush the cheek side and tongue side of your teeth. Be sure to brush each tooth on all sides. After the top, brush the bottom. Then brush your tongue too. This helps to get rid of bacteria that cause bad breath.
My friend Novi says I should brush my teeth for 2 times a day for 2 minutes. Is that right?
Yes, it takes 2 minutes to brush your teeth well, and you should brush your teeth at least 2 times a day. My patients tells me lots of fun routines they have when they brush their teeth. What is something you like to do?
I know it's been 2 minutes. Well, my electric toothbrush turns off.
Excellent! This is a terrific place to start your oral health journey.
How to adapt a toothbrush.
Are there other challenges Special Olympics athletes might face when they're brushing their teeth?
Some of my patients struggle to hold a normal toothbrush, but there are plenty of solutions. For example, they can make the handle bigger by placing it in a bicycle grip or tennis ball. You can also try to bend it to make it gripping the toothbrush easier. These adjustments can get to all the hard-to-reach places in your mouth.
One of my friends uses a bicycle grip on the handle of a toothbrush. It's good to know that all of us can brush our teeth well. Thanks, Dr. Ho.
How to floss. Thank you for helping me out with all my dental questions today. But I still want to learn more about flossing.
Flossing? Sounds wonderful. I'm a bit of an expert myself. During visits, I like to demonstrate the right way to floss your teeth. We begin by wrapping a piece of floss around each finger, holding it like this. Slide the floss gently between your teeth, but make sure it does not reach the gum. Gentle is important. Flossing shouldn't hurt. When the floss reaches the gum line, curve it into a C shape against one tooth and slide it into the space between the gum and the tooth. Move the floss away from the gum with up and down moves. Repeat these moves with clean floss on the rest of your teeth. Don't forget the back side of the last tooth. Floss daily, and once you're finished, throw away the floss.
That looks fun, but I like floss picks. Are those okay?
Yes, they sure are. Pick the floss that is most comfortable for you. Clean the floss pick after each tooth to remove the plaque. You can also use a floss holder, which works really well if you can only use it with one hand.
Sometimes my gums start to bleed when I'm flossing. What does that mean?
If your gums bleed while flossing, it just means that they need to get healthier. When you continue to floss, you will notice sensitivity going away. After a few days, it won't happen at all. Just like working out or preparing for a sport. Sometimes it's hard or your muscles hurt, but with practice, it becomes easier and your muscles are stronger and healthier.
It's just like training basketball. Thank you, doctor.
Why your oral hygiene is important. Now that I know how to brush and floss, can you explain why oral health is so important?
Oral health is important for your overall health. Having a healthy mouth allows you to eat, speak, sleep well, be alert, and compete. Everything from your brain to your heart to your feet is important by oral health. It is all connected. Teeth are the strongest part of your body, harder than bone. If you want to avoid getting cavities, it is important to know what causes them.
So, what causes a cavity?
A cavity is a hole that can grow bigger and deeper over time. A cavity forms when there is an excess of acid on your tooth surface for a long period of time. There are acid that comes from food like sweets or even fruit juices.
Huh, that's interesting.
There are also acid that comes from your stomach. Some of our friends are more prone to upset stomach and may need a doctor to see if they need medicines. When our mouth is dry, we are lacking saliva. Saliva is the body's natural mechanism of neutralizing the acid in your mouth. Bottom line, if you have good quantity and quality of saliva, we don't get cavities. Things that can cause lessening of salivas are medications, mouth breathing, and not enough water. These are the risk factors for cavities, and your dentist can help make recommendations to reduce those risks.
Okay, let me see if I understand. To reduce cavity risk, I need to brush and floss properly to help keep acids off my teeth. I also need to go over my list of medications with my dentist to see which ones may cause my mouth to dry. I need to drink a proper amount of water and make healthy food and drink choices.
Exactly. We also have a treatment to help make your teeth stronger. It is called fluoride varnish. For those at greater cavity risk, we have dental sealants to help prevent sugars from staying on your tooth surfaces.
Last time we spoke, you showed me a neat mouth-body connection quiz that's available on the Smile Generation website.
Thank you for reminding me, Justin. The Mouth-Body Connection Quiz is a great resource for explaining how dental health connects to your overall health. Every time you breathe, whatever is in your mouth goes into your body. So good oral health betters your heart, your lungs, and even your self-confidence.
Thanks for answering all my questions and sharing your tips. Can I call your office if I have more questions?
Of course, I always love hearing from you. Or you can always come to see me or any other dentist when we volunteer at Special Olympics Healthy Athletes Screening. Until next time.
COVID safety at the dentist. COVID-19 It seems to impact everything I do these days. Will it affect my dental visits too?
Great question, Nobi. With COVID-19 as a concern, there are a couple of things we should know before going to dentist. We want to make sure you and others are safe.
You will see us wearing special coverings like a mask, shields, gloves, gowns to make sure we keep you and ourselves from spreading germs. We may give you more space than you're used to in order to keep you safe. You will most likely be asked to come to the office with a mouth covering and possibly be given a mask to wear inside the office. Some Special Olympics athletes and other patients may not be able to wear a face mask. We understand if a person cannot tolerate due to their diagnosis, but it is strongly encouraged at this time. Practicing at home with scarves or face coverings may help.
When you walk in, we'll take your temperature to make sure you don't have any fever and ask a few questions to determine if you have any COVID-19 symptoms or if you have been in contact with someone who is sick. We do this with all our patients and staff because we want our team to be as healthy as possible when we take care of you. It is important you wash your hands with soap or use hand sanitizers and avoid touching your face to limit the spread of virus and other germs. Wash your hands or use hand sanitizer before and after you use your mask.
At home, make sure you keep your toothbrush and floss away from other members of the household, and remember to keep the bathroom counters clean. Hope to see you soon.
Talk soon.